Now, one of the crises that he's going to be facing is the coronavirus pandemic. So I want to talk about that next with our panel. And it's loomed large over not just this inauguration, but also the start of Biden's presidency. We have Dr. Amesh Adalja, senior scholar at Johns Hopkins Center for Health Security, as well as Joe Grogan, former head of the U.S. Domestic Policy Council, joining us right now. For everyone at home, Joe is also the former White House COVID-19 task force member. Doctor, I want to start with you. You've said before that you want President Biden to take the handcuffs off the CDC. How optimistic are you now with this new administration going forward? And do you think that essentially the United States was hobbled in its coronavirus response because of the last administration?
I'm very optimistic because if you look at what President Biden has articulated and the importance he's given the pandemic, it really encompasses much of what we've been saying in this field for over a year now. All of the actions that needed to be taken are likely to be more likely to be taken now. We're also going to see much more leadership from the president, as well as a belief that science should guide this response and an ability to let the CDC, let the NIH speak directly to the public, where there's not so much of kind of massaging of the message to fit political aims, but a message that's really aimed at ending this pandemic as quick as possible. And I think we're already seeing that happen. And I do have a lot of optimism. But no matter who's in charge, we still have a tough road ahead of us because we're talking about a pandemic that is moving at lightning speed right now, a vaccine rollout process that is very flawed. And so it's going to be a challenge for anybody, even in the best circumstances.
You mentioned science in the way, and we're going to have a new science advisor to the president, Eric Lander. But help us understand the promises that are being made. 100 million vaccinations within 100 days. At the time that New York City says they have postponed second doses because they've run out of vaccination. How are we going to do 100 million in 100 days?
So that is a very ambitious goal, but we are nearing about 900,000 doses per day. So I think it is something that is achievable and realistic. Hopefully, in Operation Warp Speed, the part of it that was really a success was the manufacturing. Hopefully that manufacturing process will be able to catch up so second doses can be given at a regular time. And I think it's going to be something that we're going to have to kind of titrate to see how the vaccine rollout is going. But what you see from President Biden is a very articulated response using FEMA, using the National Guard, mobile vaccination units, really trying to make this an all-out war effort where all hands are on deck. And I think we can do it. We can follow the example of countries like Israel and the United Arab Emirates that have done much better than us with vaccination. So this is something that can be achieved, and I think we should hold the president to this.
Joe, you understand policy. Can we do this? We can hold them to it, but will they achieve it?
Well, thanks for having me. I too believe that 100 million is doable. As you said, we're at 900,000 a day now. There is no question that there are bottlenecks and there were some screw ups in developing the distribution plan, not because it didn't look good on a slide deck and didn't have enough centralized federal control. Actually, the opposite. There was too much federalized control, and we didn't use our private sector distribution channel enough and defer to them. I would hope that the Biden administration, while they're looking to get more vaccine into the arms of people who may be disconnected from the health system, will also call up the big distributors, McKesson, AmerisourceBergen, Cardinal, and the people that run our pharmacies, CVS, Rite Aid, Walgreens, and say, how many vaccines could you take, would you even buy, and how many people could you get vaccinated? I think in many areas of the country, people would be more likely to get vaccinated and trust a pharmacist who may be their primary caregiver. Let's recall in parts of this country, they don't have regular access to doctors, and they would be more trusting these people than somebody showing up with the National Guard in camouflage with a needle in their arm and saying, we're from the government, we're here to help you. So I think 100 million is doable in 100 days. I don't think it is that much of a stretch, but let's not forget, you need 200 million more to get everyone vaccinated in the country. Now, is that the goal? We probably don't need 300 million to move beyond this epidemic, but you do need more than 100 million. We do 90 million a year with the flu every year. So getting to 100 million is not an impossible task, and it is achievable. And I am optimistic that they will hit that target, but they're going to need to adjust their plan as it gets unfolded into the real world.
Joe, when you say that there was actually too much federal control and involvement, I'm curious to know what you mean. Just because I have spoken to doctor after doctor after doctor, a public health official after public health official for weeks now. And it seems as if the common refrain among them all is that, frankly, the rollout of the vaccine and as well as the testing for this virus has been largely left to states and local governments, which are already stretched thanks to the pandemic, already stretched financially because of the pandemic. So, where do you see really as there being too much federal involvement when so many folks are saying, listen, we actually need to bring the full resources of the federal government to bear to really coordinate an effective coronavirus response and a vaccine rollout?
Well, setting aside the testing that you mentioned and just sticking strictly on the vaccine, remember the federal government bought every dose. And as your other guest mentioned, they did a great job in ramping up manufacturing and buying the vaccine doses in advance. But you could not get your hands on the vaccine without federal approval. So the federal government was approving where it was to be sent, what states were to get it. And I absolutely agree with you. They did not give enough money quickly enough to the states, nor did they give enough direction, except in certain instances where they gave too much direction, where states deferred to them too much and said, hey, listen, the CDC guidance says we can't give this vaccine to people that aren't in these categories, and we can't find enough people in these categories. There aren't enough people serving in medical settings who are willing to take the vaccine. So then vaccine sits on the shelf. This is the problem with central planning. People make decisions in the real world that upset your central plan. And the fact of the matter is, as I said before, we get 90 million people a year vaccinated for flu. So what they should have done is supplement the private sector channel with federal distribution in those areas where there wouldn't be access. But we can get vaccine to America's pharmacies, to America's commercial channel. I could go, you could go and go get vaccinated. We will have enough vaccine in the coming weeks for most people who want to go get vaccine, and more will be coming online. Johnson & Johnson will have a vaccine, I'm confident, relatively soon. I think there's a role for the AstraZeneca vaccine. They might need a little bit more data. And Pfizer and Moderna continue to ramp up. So the problem is not necessarily the federal government wasn't developing a plan. The plan didn't work. And that's what happens when you have a small group of people trying to mastermind a huge plan for the government, whether they're Republicans or Democrats. You have to recognize that when a plan gets unfolded in the real world, it is not going to work as planned.
All right, let's say thank you to Dr. Amesh Adalja, Senior Scholar at Johns Hopkins Center for Health Security. So Joe Grogan, former head of U.S. Domestic Policy Council.